What happened to nursing being ranked as the #1 most trusted profession for 20 years straight, according to the Gallup poll? Now nurses are going to jail with criminal charges? Welcome everyone to the Mama Nurse channel. I'm Vanessa, and here we discuss all things nursing, motherhood, and lifestyle. Make sure you leave a like on this video. Comment down below. Do you think that all these nurses being on trial is the new trend that's going to start? Or do you think it will simmer down and they'll find some other way to penalize nurses for mistakes? Comment down below. Don't forget to subscribe to the channel and make sure you hit that notification bell so you don't miss out on any uploads. If you are a nurse or in the healthcare profession, you have noticed that nursing has taken a big shift in the last few weeks. Now, these cases that we're going to discuss occurred a few years back, some as far back as 2017, but now these nurses are being placed on trial and being charged criminally. So let's dig in, see what's going on, and stay tuned till the end so you can find out how to protect your nursing license that you worked hard for. Over the years, the nursing profession has been experiencing a nursing shortage. When the pandemic hit, it proceeded to get even worse. Censuses were above normal in all departments. Nurses felt undervalued, unappreciated, and overworked. Nurses then began finding new ways to make money besides being at bedside, which increased the nursing shortage even more. So like I said, even though these events occurred a few years back, these last few weeks we have seen nurses being placed on trial for mistakes that they've made in the workplace when it comes to patient care, leading up to deaths of their patients. So let's begin by very briefly, discussing the 3 cases that I'm referring to, and make sure you stay tuned until the end for my advice on how you can protect your nursing license moving forth. With this new season of nurses being put on trial for patient deaths, I can only imagine the shortage getting worse and more nurses walking away from bedside. Will you be one of them? The first case we're going to discuss is Redonda Vaught. This case occurred in Tennessee at Vanderbilt Hospital. In 2019, Redonda was indicted on 2 charges: reckless homicide and impaired adult abuse. The actual patient death did occur in 2017. The events leading up to the patient death included Redonda administering a paralytic vecuronium rather than a sedative, which she thought was Versed. The patient was not intubated or being monitored appropriately during and post administration, especially not for a patient receiving a paralytic. On the night of the incident, Redonda did have an orientee with her that was training. Many safety features that are in place to protect nurses, their license, and their patients were skipped or overlooked on the night of the incident, such as medications not being scanned and alerts being bypassed. The patient ended up coding down in CT. Redonda did immediately admit to her mistake and notify the appropriate people, but it was a little too late for the patient. For full details on this case, please check out Nurse Liz here on YouTube. She goes into full detail on what happened during these cases, what led up to the events, and the outcomes that we've seen thus far. So I will link her videos down below. That way you can get the full details of these cases. The next case we will briefly discuss is Christiane Gainey. This case took place in Philadelphia in 2018. Christiane was charged with involuntary manslaughter, neglect, and records tampering. This case involved father of a former Trump security advisor. The patient was an 84-year-old man who suffered a stroke and later went to a rehab center for some rehab before hopefully going home. The patient had a number of falls leading up to his untimely death the morning that Christiane was taking care of him. On the 3rd day of that patient's admission to the rehab facility, he had a fall that led to his death. The patient was found on the floor in his room by a nursing assistant who informed Ms. Gainey, who was the charge nurse that night. Per policy, the facility requires close neurological monitoring for patients who have fallen and hit their head, including assessments every 15 minutes times 1 hour and then every hour times 3 hours. Apparently, after the patient fell and was found, they brought the patient to the nurse's station for close monitoring, but video surveillance showed that these assessments were not completed. Upon later investigation, it was noted that an assessment had been documented 20 minutes after the patient was declared dead. Gainey did admit to falsifying that entry. Police then reviewed the surveillance video that showed that Gainey never completed not one neuro assessment. The medical examiner ruled the death as blunt impact head trauma. The third and final case that we would discuss is Michelle Huggins. This incident took place in North Carolina, in which 5 detention officers and a nurse were charged with involuntary manslaughter in the death of a man aged 56, who was charged with assaulting a woman just 24 hours prior. About 24 hours after his arrest, the patient was in his cell on his top bunk. It seemed like he had some type of seizure activity and fell from his top bunk, in which his cellmate reported it to the detention officer. When he fell from his top bunk, he hit the concrete floor. He was found disoriented and confused. He was taken from his cell to an observation room, where he was placed in restraints and hogtied for 12 minutes. During this incident, the patient had defecated on himself, vomited, and had blood around his mouth. I'm not going to go into the details, but like I mentioned before, Nurse Liz goes into great detail on the events that led up to this patient's death. And there is video online, if you can tolerate it, that shows exactly what occurred. Prior to his death, the patient pleaded that he needed help, tried to get up in order to breathe adequately, and stated that he couldn't breathe and even called out for his mom. During these events, the nurse was not in the room. The patient had 5 officers around him trying to restrain him, and at one point, the lead detention officer was seen walking out of the room, and I'm gonna assume that he was talking to the nurse, but the nurse stated and recommended that they lay the patient flat and remove all of that weight from his back so that his lungs could expand and he could breathe adequately. The lead officer later states, "I don't advise that, but I'll do it if you're telling me to." Once they did try to remove the restraints, the key broke in the lock, causing a delay in them being able to remove it. They later had to try bolt cutters to remove the restraints. Once they were finally removed, they released the restraints from the patient and they exited the room. Right before the restraints were removed, the nurse did go into the room to assess the patient. Once they removed the restraints and everybody exited the room, you can see the nurse looking in through the window and seeing what the patient was doing and questioning whether he had a heartbeat and if he was breathing. The final autopsy did show that the patient died from a brain injury caused by cardiopulmonary arrest that was caused by positional and compressional asphyxiation. This doesn't sound like neglect by a nurse to me. This sounds like detention officers' neglect. Comment down below, how long are you supposed to check a pulse before you initiate CPR? Now, in all fairness, I'll be honest. The nurse took quite a while she was checking for a pulse in order to initiate CPR. Although she did follow the correct step, there was just a delay in the response time as far as initiating CPR. I do feel like more training is needed when it comes to detention officers, especially in this case, when it's related to a medical event. We as healthcare professionals know that in moments of distress, a lot of times patients are not thinking in their right mind and they will try to get up. You can't restrain somebody who is in distress. It's going to exacerbate the symptoms and make it seem as though they're combative or aggressive. That's not the case. Their body is fighting for the oxygen or fighting for whatever it needs. And in that moment, you have to be able to calm that patient without restraints. That way you can take care of them and help solve the distress that they're in. If this patient received medical emergency interventions rather than detainment, he could have potentially lived. But the focus in this case was on the patient's aggression and not listening rather than the medical emergency that he was experiencing. When it comes to the first two cases, the nurses made many errors. Redonda bypassed many safety features that were put in place to help prevent errors. Ms. Gainey falsified documentation and did not assess her patient adequately or efficiently post-fall, as seen on video surveillance. In the third case, Michelle initiated CPR, a little delayed, but followed the appropriate steps. During the events leading up to the patient's death, Michelle did not have access to the patient leading up to the events that occurred. She was out in the hallway while 5 detention officers were on top of the patient, holding him down for those 12 minutes. So why is she being charged for the patient's death? When it comes to emergency situations, working in the medical field for 8+ years, I have seen situations where officers come in, nothing against officers or security guards, but they come into the room in an emergency situation, and as a charge nurse, I have asked them to back down for a second so that we could medically treat the patient. I will admit that in those situations, nurses have to step up. They do have to be that force and voice of reason for their patient. In this situation, Michelle was a temporary employee. It was not her normal facility, so maybe she did not feel confident in speaking up at that time. But that's what nurses are here for. We can assess and see that patients are in distress, and when we need to advocate for our patients, we need to be able to do that. As shy as I am, I have asked security guards to please step back for a moment. That way we can take care of the patient. If and when that time comes that you need some manpower, then you can allow them to step back in. But it's not always pertinent to have that manpower starting out at the beginning. Let me say this, when it comes to a nurse losing his or her nursing license, that's like a life sentence. That's your whole career, everything you know. Once you lose that nursing license, you have to start completely over. I do agree with the first two cases, those nurses losing their license in regards to the events that occurred, because they were unsafe and they were not thinking about their patient at hand. However, I do not feel like they need to be criminally charged or have jail time. If a nurse intentionally causes harm, then by all means, send them to jail. They deserve it. But I do not believe that Redonda or Christiane intentionally meant to harm their patients. Neglectful? Yeah, I could say that, but not criminal. When it comes to Michelle's case, I don't even know why they're moving forth with it. They released the 5 detention officers of all charges and are now just focusing on her and putting all the blame on her. And she wasn't even in the room for majority of what was going on. But I guess they have to blame someone. These are just my opinions in regards to these cases. Obviously, some of these nurses have already gone on trial and been charged. Others are still awaiting their fate. Personally, I don't think that nurses should go to jail unless they're intentionally causing harm. A mistake is a mistake. Penalize them by different means, not jail time. Now let's get into ways on how to protect your nursing license moving forward. Scan your medication prior to administration. Follow the 6 rights of medication administration. In most hospitals now, they do have scan rates. So if you're not scanning your patient or not scanning your medication, those percentage rates are calculated each quarter. And at many hospitals that I've worked at, they post them on the bulletin board so that everybody can see who's scanning and who's not. To me, that's embarrassing. I always want to have a good scan rate. So make sure you're scanning your patient and your medication prior to administration. This is a safety feature to prevent medical errors and patient harm. Make sure you document what you have done and what occurs during your shift. A simple nurse's note can go a long way. If you don't feel comfortable with something, ask your charge nurse. They're your resource and they're there to help you and guide you with anything that may occur. If you are not familiar with a medication, do your research prior to administration. Use Lexicomp. It's great. It's your friend. It has details, compatibility, medication uses, dosages, everything you could need when it comes to medications and healthcare related. And most facilities have Lexicomp built right into your MAR. Make sure you utilize this tool. And last but not least, continuous education. Stay in the know what's going on, know what changes have been made when it comes to medications, policies, procedures. That way you're up to date and can take care of your patient adequately and safely, and protect your nursing license. Like I said, this is my opinion on nurses in these cases. So let me know how you feel down below. Do you agree? Do you disagree? Are you for nurses going to jail, or are you against it? Let me know down in the comments. Make sure you leave a like on this video. Don't forget to check out Nurse Liz down in my description box. Also, the Momma Nurse Shop is now live, so make sure you check it out. A lot of resources will be coming in the next few weeks. Don't forget to subscribe to the channel so you don't miss out on any uploads. And until next time, all love.